Hi, my name is Elise Starks Daniels. I am in the Atlanta, Georgia area. My current employee role is I am a clinical consultant slash engagement owner for Oracle Health. We do electronic health record implementation for the VA project. So clinical informatics, I guess, is a better way to say. That is my current role currently. Um, as far as my experience with pediatrics, I don't have a ton of experience with pediatrics per se, except for, I would say, my nursing clinicals, um, interacting with my own children, and when I go to school with them and, seeing the kids there, interacting with them. And so that's been like the gist of my interaction. In my last clinical, my preceptor did have quite a few pediatric patients. So I did get to experience it through clinicals during my last rotation, which was pretty interesting, especially with how you have to tailor questions to meet that population's needs. Um, And the last question is, what do I know specifically about the pediatric adolescent population and specific health needs or vulnerabilities? Well, one thing I do know is that if children don't feel safe, they may not interact, or their communication might be limited. And so being able to, treat them properly, they have to have a safe and comfortable space, which, depending on the child, it might take a while. It might not come automatically within, one session or even right away. So those are definitely things to always take into consideration. Also, what their diagnosis is. A lot of children you see with ADHD, um, which is, not uncommon at this point. Well, during this day and age, growing up, we never heard of, kids with ADHD. Just they needed to go outside and run and play and, work off some energy is what we were always told. They had too much energy. But now, understanding that, a child's capacity to concentrate and focus can be more than just, needing to burn off some energy. It can actually be, other things that are going on. Also, a lot of times, children who have traumatic experiences can lead to, sometimes it's the leading, or can open up other, issues or mental health issues. And then also, their family history is also something to definitely keep in mind, especially with dealing with pediatrics and adolescents, those that have like a long family history of different medical conditions or mental health conditions. So that is it. I look forward to this course and everything that we'll learn during this clinical session.